work with Zoe and Charissa. I'm the district sanitarian. My name is Alvina Clark-Joe, and I've been in this field for almost 17 years.
Good morning, everybody. My name is Rochelle Morris. I'm a public health nurse, and I work at Tohatchi Health Center. And Nishlinigi A Tobahan Shledo Loge Bashis Chain do Hachitni Dash Chay do A Dashanelto Ado Twahach Edo A Nashafto.
Good morning, everyone. My name is Julie Thomas, and I am a public health nurse from the Shiprock Service Unit. And I've been with the government I've been a nurse for over 30 years. And but ahnin shlo shi bashish chin na kaidane dashanala kelachine dashanala. I get that mixed up, but I think it's right. But I wanted just to share, if they could include, I live in Dolores right now, been there for close to 30 years, and I was a victim of a bad assault years, my son's 35 years ago. So that caused me to move off the reservation because I felt like myself and my family and my children were not going to be safe. And so I know that crime's everywhere, but I just needed to be reassured in my heart that that's where I wanted to be. So I moved off the reservation. So I wanted to add our town into your possible places where you can meet. And in Cortez, we do have a lot of street people there, and a lot of them have died of exposure. So a lot of it took a long time for the the leaders there to focus on the problem in our town. A lot of people in the Utah sector come to Cortez to do their shopping, and they pour a lot of money into that town. So they just built a really new facility it's called the Bridge, and it got dedicated I think in October. So it houses people that are left out in the street, have no places to go. They house them for the night, give them a hot meal. And then the churches, there's a United Methodist Church, stepped up to the plate and provide 3 meals, lunch, Monday, Wednesday, and Friday for the street people, whoever's in need of a hot lunch. So it's getting recognized, and hopefully we do better as far as helping our homelessness. And I think it's not going to get better because things are getting harder for people. So I thank you for saying that, practicing some humility in our life. You think that your life is bad, but there are people out there that are very in worse shape than us. So just pray for them, I guess. So I would and then encourage some counseling for people. I went into this deep hole, and I slowly crawled back out of myself with the prayers of my husband and myself working diligently to get me better. So you don't only deal with the trauma, you deal with the afterwards too. So it's a hard thing, but it took me a long time to talk about it. So anyway, just to let you know about that. Counseling is probably one of the best thing you could do for a survivor. Thank you.
Good morning. My name is Ethelenda Manali. I am a public health nurse at Shiprock. I am from Farmington area. I currently live in Farmington. Been a nurse for 20 years. I've been at Shiprock for 5. Some of the communities that we cover are rural, just like everywhere else on the reservation. Thankfully, as far as I know, I haven't had anybody missing or murdered in my communities. But God forbid if it ever happened, I'd like to know the resources I can give my patients to help them and their families. So, hoping to learn more today.
Yeah, Tapene, she is Stephanie Wilson and Chiedo, Shkazo, and Shlido, Twitchini, Bashichin, Tanajini, Dashanelago, Twitchini, Dashachi. Neslinde go a Gisina Shadow. I'm here with Chinle Indian Health Services. I'm a health promotion disease prevention specialist. So we serve the Chinle communities. So right now we have a coalition called the Central Community Improvement Team, and it's related dealing with health issues within our communities of Chinle. And we also, the Chinle Service Unit also has a health council out in the Pinion area as well as in the Tsaili area. So just recently we do have a missing female out in the Pinion area. So I know we don't have this in the Central Navajo Nation as far as I know, so this is really interesting to learn more about it.
Hello, good morning, everybody. My name is Maricela Salzer. I'm a victim advocate with the District Attorney's Office here in Gallup. I just like to say I really want to learn Navajo because it would be awesome to say something in Navajo. But I'm really looking forward to learning more and being here. This is my first time. I'm new to my role. I'm not Native American, but I feel that this is something that could help me bring awareness to what goes around, happens pretty much in the surrounding area, and how my role can help those in need and pretty much help families, but particularly women, because women really need empowerment to get through all this type of stuff. So yeah, that's about it.
Good morning, Nana. My name is Larry Foster. Do kia anid nansle. Ado zitlani bashische. Ado tapmai dashiche dade. Ado kinlishini dashanal. I'm a representative working with the Indigenous Peoples Commission here in Gallup. So our job is to gather information about discrimination and violence and homelessness. Right now I'm volunteering right now with Gallup Rehab Center with the Medicine Man Sweat Lodge Services. I get to counsel a lot of clients, I guess relatives that are coming out of prison. And one of them is that was released was he spent 14 years in prison. And he's from the Four Corners area. And he claims to be the biggest meth dealer in the Four Corners. So he's released. And I first heard of the MMI missing person when we went to Standing Rock in 2017 or 2016. So the different tribes had that. They were speaking about that at that time. They have that red mark on their face. So that's what they represented, and they put red dresses on the fence there. So their tribe, some of them came from Canada. So the way they spoke about, Canada has a really big problem with that. The truckers, we got an interstate here, we have to be mindful. And then unsolved cases. I think we have a few here in Gallup. So a lot of that incidents, that prevalence of what happened up there are kind of compared to the border towns. So yeah.
Shiroya de edition Shaya Mario Foster and Shado, but uninstalled do Twitchini, Bashino, touching the Shnado Shin, the Shichi. Do yeah, do Shaya doing a lot of volunteer work in the Gallup area with my husband right here, and I'm retired from Fort Wingate High School after working with students for 48 years and 8 months, and now I'm just doing a lot of volunteer work. Also, we had way back, probably in the early 1980s, we had a student, a young girl, that was snatched by a man from the school, and they never found her until later. I think they found her, just her bones, and I don't know what has happened after that. And another gay student, I guess he was doing sex trafficking on the trucks at the truck stop, and they found him somewhere in California. So this unsolved. So I guess there's a lot of women and young mans or anybody that are out there still missing. So, you know, my prayer goes out to them. So as being a mother, a grandma, and an ollie, so just wanted to say thank you again.
Good morning. My name is Dilma Dickey, and I am from Pinedale. I lost a daughter a year ago, and then she was missing for a while, and we had a hard time trying to locate her. She was in OMI in Albuquerque for 18 days, and we had a hard time trying to locate her, and all the police had known that she was there, and we had reported her missing a couple times, but I don't know how they had missed her, and we had called and tried to locate her. And then I had a sister that's been missing for 25 years that nothing has been done for her. So we're here to gather information, or trying to get information as to what to do afterwards, like the legal aspect as to what can be done. The reason for the 25 years is because the body was found on the Isleta reservation, and we've been having a hard time. The FBI keeps saying, well, we're still working on it, we'll try and find out. Every time we ask about it, that's all the information we've been getting. On the one for the year ago, everybody that we've called and contact, everybody says, well, we'll call you back, we'll contact you back. And we've even gone to Albuquerque several times. Different groups that we've talked to either say hire a lawyer or find an attorney. When you don't have money, you really don't have no place to go, no resources that's available. You don't have money. So now I'm trying to find resources. That's why I'm here. This is actually the first time I'm to this meeting. So that's why I wanted to find out, what else do you do afterwards? When somebody's not available, what other people do you find? That's why I'm here. Thank you.
Good morning. My name is Tiffany Gray, and I am also a family member of someone who has gone missing and who's been found murdered. And I'm here also just to get more information on resources. Just a lot of, referrals being made. Go here, go there, ask this person, ask that person. But a lot of the problems that we face are lack of funding. There's so much lack of funding, or lack of people that are capable to actually help in certain areas, and then we run into the problem of jurisdiction. Jurisdiction is always a big issue, especially when your relative is missing from the Navajo Nation, but their body's found within city limits. So just trying to find more information on what can be done as far as trying to help others in the same situation, because I know we're not the only people that face that.
Good morning, everyone. My name is Candace Livingston. I'm a legal intern here at the District Attorney's Office in Gallup.
Good morning. I'm Richard Malone. I'm with the Office of the Medical Investigator here in Gallup. I've been doing this for about 40 years now, and we work with all of the different law enforcement agencies across the region, everyone from the Navajo Police and the FBI to the city police in conducting death investigations. But we also work with families, and we meet them at the most difficult time in their lives, and we hear stories that are heartbreaking. And for many people, without coordination and cooperation from everyone, they don't get answers. And we are on the right track by being here this morning to coordinate and to collaborate and to share so that we can bring answers and conclusions for folks who are hurting because they don't have this information. So I'm honored to be here. Thank you very much.
Hello, my name is Cassandra Bahi. I do work with the Office of the Medical Investigators as well.
Good morning, everybody. My name is Paulina Houston, and I too work with the Office of the Medical Investigator.
Good morning, everyone. Yat Eshe, Yoshalin Yashia. Tachi Nishlona, Kedina Bashichin, Todachini Dashiche, Tatnazatni Dashanale. I work with the District Attorney's Office. I'm a victim advocate. Marcella is also my colleague. This is our first year working as victim advocates. And for our office, we navigate victims and survivors through the court system. A lot of times our community members, they do not know how the court system works. So we explain to them the court, how it's processed. If they have if they want information on trying to get restraining orders, we would provide help with that. Also, transporting them to court is one of the things that most of our victims cannot get to court on time, or they don't have a vehicle. So we do that as well. We also provide them with services as they need counseling, grieving, child care if they need to find resources for that as well. We try to help in any way that we can. So being here today gives us more information on what else we can use and put underneath our belt to help the community members within our area. And it's just not within Gallup, it's Navajo Nation too. They would call our office. Even though we don't have jurisdiction on that end, we try to do whatever we can. So we don't turn away anyone who needs help. We try to help them with whatever we can. So we're pretty new to the area, and I'm pretty happy to see a lot of the people here that I could kind of go off of and ask for information and more services. So if you guys have like other trainings as well, call our office. We would be happy to go if it's free. Okay, thank you.
Good morning, everyone. My name is Summer Merez. My clans are Sanjakina, Nishle, Ashinhe, Bashishtin, Kisani, oh wait, no, I'm sorry. I'm so nervous. Okay, Sanjakina, Nishle, Twitchini, Bashishtin, Kisani, Dashiche, Ashinhe, Dashanella. And I am a victim advocate with Sexual Assault Services of Northwest New Mexico here in the Gallup office. We do have a main office in Farmington, and we are a nonprofit agency that provides services to any victims of sexual violence, and all of our services are free and confidential.
Hello again, my name is Kimberly Martin. I also work with the Sexual Assault Services as the victim advocate.
Yate bene Patricia Nelson Yanishia Tochi Nishle to Tabahe Basishin. Good morning, everybody. I formerly worked at Battered Families, and so after we were let go, that broke my heart because that affected the community. It affected the client especially, and so my colleague and I, Christian Vasquez, we took the initiative and we started our own nonprofit here in Gallup called Strengthening Nations. And so we volunteer 100%. We're not waiting on grants to assist clients. Everything that we provide to clients is out of pocket. Diapers, right now we're working on Thanksgiving boxes. And so if you guys have any clients, I provided legal advocacy, and so for victim services, I assist with all of that stuff with court accompaniment, everything that I've been familiar with that for the past 8 years. And so that's what I do.
Good morning, everybody. My name is Frank Boyd. I'm the Chief of Police with the Gallup Police Department. I'm here with some of my command staff officers, our detective and patrol division. We'll be here throughout the day, dropping in and out, as well as tomorrow. Some of my detectives will be here. If you have any questions or want any stats, obviously tomorrow we'll get more in depth, but feel free to approach me or any of my officers to ask us any questions you may want. exchange some information, and we're always here to follow up and answer your questions. Glad to be here. Thank you.
Good morning. I appreciate all of you coming out. I know the weather was kind of a surprise this morning, but those that came out, I appreciate it. My name is Erin Totolina Pablo, and I'm with the Gallup Police Department. I'm currently holding the position of a captain. So I oversee the support services, which is the investigations unit, records. We've just upgraded to a new reporting system, what is called Tyler Enterprise. So we're hoping that's going to help and assist us in gathering these stats that will help us to understand and follow up on cases that we are assigned or things that come on in. But we're here, like the chief said. If you have any concerns or any questions, we'll be out through this whole day and tomorrow. But thank you very much.
Good morning. My name is Cindy Atine. I am the principal victim witness advocate for Gentle Ironhawk Shelter in Blanding, Utah. And just real quick, we're not open fully yet, so we are getting ready to start hiring some workers. If you know anybody, it'll be on the Navajo Nation HR website. Thank you.
Good morning, everyone, and Cindy is my sister, and my name is Cheryl Atine, and I basically came from up north Nevada, from Shoshone country about a year ago, and I really want to express my gratitude and appreciation for the Grassroots Coalition. While I was in Northern Nevada, I was a part of the Northern Nevada Suicide Coalition for 17 years. And so with that, we started our first suicide walk in Nevada in 2005 with only 85 walkers. And being on that committee today, just in Las Vegas alone, with our past suicide walk, we had over 3,000 walkers. And we have grown with the coalition. While I was on it, I was the tribal representative for 27 tribes representing the state of Nevada. So in that note, I just want to let everybody know that your grassroots coalitions are very powerful. The working, the volunteering, and the collaboration is really important. It is actually my passion. I had no clue about suicide prevention. On the other note, I work for NTU, and I am the counselor there. The counselor there for the students. We have over 1,000 students there, so I am building that program for the students there at NTU. Thank you.
Good morning. My name is Adeline June. I work with the Gallup Indian Medical Center. I manage the Zero Suicide Initiative project for Gallup Indian Medical. Basically what ZSI is another name for it, it's the acronym for it, is a comprehensive approach in the behavioral health and the health system to reduce the incidence and prevalence of suicide in for those patients who come through our program. So, thank you.
Yatishike, Shaylas Chido Nenchla. Ane das Jep, Anish Cheda, it was a Diné das Nulle, the chronic Achigoi Wilfred Moses with Oshiji. Navajo Treatment Center for Children and Family, Ibanashis, as a traditional practitioner. Grandma and Grandpa's teaching and the ceremonials that we still have, use that in our program, working with the children that have behavioral problems throughout the Navajo Nation.
Thank you, everyone, for your introductions. It looks like we have a very diverse collective here, and I'm really happy that you are here, especially our law enforcement One of the major objectives that we have as a working group is how can we support our law enforcement and how can we support our emergency management where they may not have enough manpower or funding. What are we as a working group doing to make sure that they also have access to, you know, not only us as a group of people, but what other relationships can be established here. It would also be a chance for everyone to kind of network now that you know where your peers are from. Shema, your story is very powerful, and you ask some very important questions of what resources can be provided to families and what happens after. So these things are recorded and these are taken seriously, and we'll make sure to figure out how we're able to incorporate that in a lot of the structures that we're creating for our community action toolkit as well as our data institute. So thank you for sharing that. And just a couple of housekeeping things. Our counselors here are on site. We do get into a lot of heavy discussions at every forum we've had individuals who tell us that they feel really drained, emotionally drained, physically drained. So it's really important that you take care of yourself and that you know what subject matters you're able to handle. If you need to take a step outside and take a walk, that's totally fine. If you need to speak with one of our counselors, if you guys could raise your hand again, the on-site counselors, we have an individual here in the back, as well as an individual here in the front. So make sure to take care of yourself, when to take a break, and I think that's really important. A lot of us work directly with not only just the families, but the subject matter, and sometimes that vicarious trauma can be triggering. So just want to honor you guys and your space and just let you know that we do have that. So we're going to go ahead and take a quick 5-minute break, and then we will jump into our next presentation. So if we could have everyone back by 10:10. Okay, everyone, if you could have a seat, we will start into our next presentation. Again, we do have our counselors on site. We do have refreshments. We have water, courtesy of the New Mexico Indian Affairs Department. So we are very happy to continue to have that support from Secretary Lynn Trujillo and her office. Again, I also want to thank our Navajo TV and film for broadcasting this online for us. And they're sitting over here. They've been with us since the first forum, so we're really happy to have them again. Also, again, another thanks to the RMCHCS, and the other support that we received came from the Navajo Nation Office of the Speaker. So I do want to thank Speaker Seth Damon and his staff for also providing support for our forums, and he's also been with us since basically we started these forums. So we really do appreciate the Office of the Speaker as well as the 24th Navajo Nation Council for all their support. So I want to go ahead and introduce Mr. Harlan Cleveland. He is the Executive Director for the Navajo Department of Emergency Management, and he will be presenting on Amber Alert. From some of the comments that we did receive from community members, a lot of them are really unclear on the Amber Alert process, what constitutes an Amber Alert, and just basically what that looks like on the Navajo Nation. So Mr. Cleveland will go ahead and provide those clarifications for us.
All right, thank you. Can you guys hear me okay? Is it clear enough? Okay. So my name is Harlan Cleveland with Navajo Department of Emergency Management. I'm the Emergency Management Director at our program. So what I'm going to do is I'm going to talk to you a little bit about how the Navajo Nation Amber Alert system works, talk a little bit of a couple of cases that we've had. I think I've got, 45 minutes? So I've got to kind of make it a little bit quick. So bear with me. Let's see if this works. Okay, let's see here. It's not showing up. It's not moving forward. Where's your... There it goes. Okay, again, this is our contact information at Department of Emergency Management. We have a staff of 4, so all 4 of us cover the whole Navajo Nation. That's Arizona, New Mexico, and Utah. And there's our phone number, our location of where we're at, our fax number. I serve as the Amber Alert Coordinator for Navajo Nation. I have our backup Amber Alert Coordinator here, who's also here, Lavina Willie Nez. We take care of pretty much all calls that come in from the police department that are referred to us. And it's not going again. Right here. Okay, so what is an Amber Alert? What do most of you think, what is an Amber Alert? I think a lot of people get the misconception of what is an Amber Alert. It's actually an acronym that was created by the American Missing Broadcast Emergency Response. And for, coincidental, back in 1996, there was a girl named Amber Hagerman in Texas who was also kidnapped and murdered. And after that, that's when the broadcasters all got together and they said, okay, we're going to create an Amber Alert. In the United States, Amber Alerts, what we get them as what you'll see in your TV, what goes across your emergency alerts, your wireless alerts, what you get in your cell phone alerts, that's what comes across. And I know there's some challenges that we're seeing in Navajo of people not getting alerts versus living in the city versus living here in Gallup, bouncing off of different cell phone towers. That's something that we're aware of and we're looking into, and we're trying to figure out how the best process in getting it across. But that's pretty much what an Amber Alert is and how it works. Of course, there has to be a child abduction. It has to meet the criteria. So for us, the challenge that we had being covering 3 states, we looked at Arizona, New Mexico, and Utah. And we decided to go with the US DOJ guidelines, and then we bumped it up a little, which is a little bit more stringent. And we'll go through that. We'll show you what the criteria is for Navajo. Again, like I mentioned, it notifies broadcasters. It notifies the state transportation agencies, what you see on the road, your DOT signs. it interrupts and disseminates the information. So that's how an Amber Alert goes across. Significant parties to an Amber Alert. Of course, there's the law enforcement. Dispatch receives the call. They start the investigation with the officer. They enter it into the NCIC system. The officer begin actively searching. They start calling in additional resources. We start pushing out through social media. The National Center for Missing and Exploited Children, they also assist us in a larger national level. They do the national cell phones, national social media. They bring in additional resources, whether it's Team Adam, K9, whatever we need, they'll bring in those additional resources. They also provide education material. They do trainings. They do a lot from the National Center. And then the third party, which is the general public, which is pretty much everybody out there, who monitor the TV, listen to the radio, any printed material, any additional resources, volunteer groups. When an event like this happens, that's when a lot of people will want to come in and assist, and they're basically our eyes and ears out there while we're looking or doing the investigation. How they're all connected. Of course, the beginning, dispatch receives the call, dispatch an officer. The officer begins the investigation out there, starts asking questions, find out what's going on. From there, informs it back whether it's going to be an abduction or not. Internally, the dispatcher will enter as a missing person into the NCIC. Based on the information, if it's an actual abduction, then it's flagged as an Amber Alert. From there, it triggers additional state resources, whether it's Gallup, New Mexico State, the larger municipalities. It triggers them in noticing the dispatchers. They also call our office. They notify us. We begin asking questions. There's a criteria that we go by. From there, we get on a conference call with the state coordinators from New Mexico, Arizona, Utah, just to say, hey, this is what we got going on. From there, we will issue our own Amber Alert on Navajo. I'll show you a map of our coverage area and the challenges that we had and that we have. From there, it'll go out to the general public, and it's a revolving cycle. Once the general public gets that information, and then they'll in turn call dispatch to say, hey, I think I've seen this vehicle, or I might have seen these people over there, relaying that back, and that's kind of how the whole thing just goes in a revolving circle, as you can see here. So when we start talking about the criteria, this is the criteria we have for Navajo Nation. That the child is not a runaway and has not been abducted as a result of a child custody dispute, unless the dispute poses a credible threat and or specific threat of bodily harm or death to the child. So that's the first question that we ask. We start asking the officer, we start asking the family, okay, what's going on here? The abduction poses a credible serious threat to the child or death of the child. The child is under 18. That's one of the requirements from US DOJ. There is significant descriptive information about the child, abductor, and circumstances surrounding the abduction to indicate the activation of Amber Alert will locate the suspect. So a lot of the information or a lot of questions that you probably have are, how come there's not an Amber Alert? We have to be able to get all that information so we can push that out. If we say, hey, be on the lookout for somebody wearing blue jeans, a black jacket with a small kid, then everybody's going to start calling. So we have to have that significant descriptive information. There is information available to disseminate to the general public which could assist in the safe recovery of the child and apprehension of the suspect. So those are the 5 criteria that we have for Navajo Nation. And those are the questions that we asked the officer in the very beginning. Okay, we have a checklist. Let's start going down. Explain to me a little in detail on what you're seeing. If it doesn't meet the criteria, and then and they want to continue to assist in pushing it out, then we strongly advise them. We need more information. Let's continue the investigation. And then what we can also do is issue a missing endangered person advisory. So we can push out that missing endangered person advisory, and then based on the investigation, as more starts to come about, then we can trigger it and push out as an Amber Alert. So just because it doesn't meet the criteria in the beginning, we'll still conduct the investigation, meet with them, and then start figuring out, okay, what do we need? Is it a custody issue, non-custody issue? What's the whole reason behind this? But again, we have this missing endangered person advisory that we can push out, and that's what you see gets pushed out from the police department social media page. Our public information officer, Christina, will put a flyer together, and then she'll push it out, and that's what you'll see. You'll see some examples as we move forward. Then we start talking about desensitization. one thing that we really want to stress and that we stress to the public is that the Amber Alert system is not for missing children, it's for abducted children. The key word being there is abducted. They've got to be abducted because we don't want to desensitize and just push out Amber Alerts every week, say, hey, we have a missing kid over here. And once we start doing that, then everybody's going to be like, another alert? Just shut my phone off, I don't want to hear it, and then that desensitizes it. And it's critical for the criteria to be adhered to prevent false alarms. Just like back in the day when car alarms first came out, when you heard a car alarm, everybody would go to the window and look out. Now you hear it, what do you guys do? Just ignore it and look at your phone. Like, I don't want to hear that. So that's one of the main things that we don't want to do is desensitize the alert. Other types of alerts, again, this is Arizona, New Mexico, Utah. They have different types of alerts. Of course, the Amber Alert, again, is for abducted children. Silver Alert, missing elderly with medical or mental issues. Blue Alert, any injury on a law enforcement officer, they can issue a blue alert. And then the missing endangered person advisory. Not all will activate the emergency alert system or the wireless emergency alert. So the top one here will automatically push out to EAS and WIA. Your Silver Alert, it'll mainly be a news reporting it or a press release from the jurisdiction, they'll push it out. Blue Alert will go out also. And then the missing endangered person advisory, like I mentioned, will go out to social media and it'll go out to the news outlets. We also have an app that I'll get into, and you'll see some of that on how it goes out. When we talk about false alarm, there was a study done back in 2004 which did a study of over 233 Amber Alerts that were issued based on the US DOJ guidelines. 30% or 70 of the 230 did not meet the US DOJ guideline, or 163 didn't meet that guideline. So when we talk about false alarms, we don't want to push that out, the desensitization, because we want to make sure everybody knows what it is, and we don't want to be pushing out like that car alarm. So when we talk about our alerting authority, before in the past, we'd have to call Arizona, New Mexico, and Utah. So Arizona would only issue for Arizona, New Mexico would only issue for New Mexico, and Colorado and Utah would only issue for their jurisdiction in their states. But the way we did it is Navajo Nation falls into 11 counties within the Navajo Nation, and we're able to push it. Once we push that alert, it's going to cross boundaries. It's going to go into New Mexico, and it's going to go into Arizona. It's going to go into all of those counties. So San Juan County, New Mexico, San Juan County, Utah, the 3 counties in Arizona, and the 7 in New Mexico, all the way down to Alamo. So we didn't forget about Alamo being down in Socorro County. We're able to push. So once we push that alert, it's going to go out to all of those counties within the nation. So that's why we get a hold of the states to say, hey, we're about to push an Amber Alert. Be aware. Or based on the information, do we just need to push it to the whole state, and then we can call the state, and then they can push it to the whole state, just depending on that information and the investigation. For national recoveries, as of August 26, 2019, there has been, the Amber Alerts have recovered 967 children throughout the United States. So it does work. Of the 58, they've been rescued because of the wireless emergency alerts. So what you get on your cell phone, they recovered 58 children based on that, and that's national numbers there. Again, the key point, making sure that everybody remembers what the criteria is, that the child's not a runaway, has not been abducted as a result of a child custody dispute. That's majority of what we see is parents not wanting to get involved with one another, or somebody filing a court order and they end up snatching their kid and say, all right, I'm taking off back to this reservation, or I'm leaving the state, and a lot of it is custody issues is what we're seeing. And then there has to be specific threat made to that child saying, I'm going to kill my child, I'm going to kill myself, all of that. We have to investigate all of that and ask a lot of those questions. Again, there's a credible threat to the child. Somebody had to have heard a specific threat. The child's under 18, there's significant descriptive information, because once we put that vehicle description out, whether it's a license plate or vehicle type, what the person was wearing, what the child was wearing, making sure there's a current photo of the child. Who all has current photos of their children? Not Facebook photos, not Snapchat photos. Most current, let's say this morning when they got up, once they got dressed. Who remembers what their child was wearing? Iffy, huh? So making sure, those are the questions that we ask. There's incidents where we've been on where families don't even have photos of their children. And that makes it hard to say, okay, we need to push an Amber Alert out, but we don't have a photo to show the general public who we're looking for, what the child. And then, of course, there's the information could lead to the recovery of that child. One of the things that we also do is we test through the Federal Emergency Management Agency. Part of our credentialing is that we test our software. This is a sample of a testing environment that we've done through for an Amber Alert. It shows up in the lab environment in Washington saying that your test has successfully went through. It went out through cell phone, it went out through TV. It does like a little recording that you can play back, but the quality is not really great. I would show you, but it doesn't really come out too great. So it pushes out to the National Hazard Radio, weather stations. Sometimes it works, sometimes it doesn't. It goes out to public text, whether you're monitoring Google, so your internet connection, all of that stuff. It'll push out to that. So as you can see here, this system was down at the time. That's why it has a red check mark for us. But all three other notifications that went out, the main ones that we want to hit, it did go through. When we start talking about press releases that we issue, this is one example. This didn't meet the criteria at the time. It was a custody issue between this individual and social service. We pushed this out, and we were able to recover that child within that same day. This is how it'll come out. It's kind of formatted like this. We'll have a picture of the child, suspect, and any descriptive information. Another one that we had, missing juvenile. Again, like I said, as long as they're under 18, we look at it and we decide, okay, how are we going to push it out? So this is what Christina will put together for us, and then we'll push that out. When we got our system, it comes with an app based. So if you download that app, we'll go through the address here. You're able to, when we push it out, it's able to go to your phone, it's able to go to your app, and this is how it looks. It'll have a picture of the individual, a little description, and then vehicle attachments. All of that will show up on there. And once the child's located safe, we'll follow up with another press release and saying that, hey, we've located the child. Thanks for the public's help. Any additional resources who helped us, that's how it'll come across. And then some examples of how you would get your Amber Alert. So based on, if you're on a national tower, this is how it's going to come across. You're not going to get it like this through Cell 1, but this is based off a national tower. So this at the time was when we were down in Tucson, we were able to get that. Sometimes you'll get whatever towers that you're hitting, you'll get multiple notifications like this when you're off or on. Depending on how long that alert's going to be running, that's what you'll get. But that's an example of how it'll look. I was an Amber Alert coordinators meeting in Florida, and we had all the coordinators from every state in Florida, and at the same time we had an Amber Alert that was issued in Florida. So on this one, we've got to be mindful. At the time, you're restricted to about 90 characters to push out. So you got to be creative in how you push it out. But with the new standard that's coming out, it allows us to change it to 360 characters. So we can put a little bit more descriptive information. But see, of course, on this one, you see Florida Amber Alert, the county, unknown. At the time, we're like, what's BF? Boy, female, boy, we're like, boyfriend, what? And then it said 15-year-old, green shirt, khaki pants, charcoal SUV. It's not a whole lot to go off of, so you got to kind of get creative of how you're going to push that out. This one, based on the time we were there, nobody reported anybody being kidnapped. Nobody reported anybody being abducted. So this case was a strange, weird one in itself, because nobody reported any of their children being abducted. But it looked like it was a little girl who was kidnapped in a school uniform type, but never panned out. Cell 1, if you have a Cell 1 phone, who all has Cell 1 phones here? What about T-Mobile, AT&T? Majority of everybody's on the larger national. But one thing when we go out and tell community members, because Cell 1 really blankets Navajo Nation, we try to tell community members, go to the Play Store on Google Play and download this app. If you don't already have it installed on your phone, you can download it and then you'll see the monthly required test. It's from what I've seen, it's only for Android. It's not for iOS yet. So if you have an Android phone, then you should be able to download this Android software operating system. You should be able to download that. This is how it'll come across for the Cell 1 network. At the end, there was an Amber Alert that was issued in Tucson. It'll show up on your phone like that, and then from there you can click the link. Once you go to this link here, you can click it a little bit more in detail. It shows an attachment part of it, and you can click that and look at the photo. But what we've noticed is a hit or miss sometimes. There's issues with this. It's a third-party vendor app that Cell 1's using. So we're trying to work with them and trying to figure out, okay, how can we get this corrected versus if you're here in Gallup and you're on a national network, you're going to automatically get, this type of alert in examples that I've shown you before. Another example of an Amber Alert that was issued out of Peoria. Again, once you click on the link there, it'll give you a little bit more further description. You can click the links there. It'll take you to the photo of the individual or the child, a little bit of more of a descriptive information in there. It also takes care, monitors imminent threats through whatever emergency alert that you push out. You're able to get that. So like this one was a tornado warning that was issued for Flagstaff, which kind of branched a little bit part of Navajo. So you're able to get not only those child alerts, but you're able to get national weather alerts. So back in 2018, we started keeping some track of statistics or some information as far as what we were called to. Beginning of January, we had a 1-year-old child taken by a non-custodial parent. Within the 2 days right after that, we had a 3-year-old wandered away from the resident. Within the next day again, we had an 8-year-old possible abducted. The next day we were hit with 2, 16-year-old runaway and a 15-year-old runaway. Back in February, a 3-year-old that was possibly abducted. So it kind of goes down. You can see what we've responded to, what we've dealt with. And the most recent one was back in 2019, August in Chinle. I'm sure everybody heard about it. The child that was possibly abducted. This person ended up driving, tried to lure a child in. Child went back, mother caught it. Mother was being observant and ended up calling the local police department. And then from there, ended up following the individual, capturing that individual, and arresting that individual. But not all of these meet the criteria for an Amber Alert, just based on the investigation, and they end up pushing out a missing endangered person advisory is what we've done. So those are a little bit of numbers of what we've had so far that are related to possible abductions. And then back in 2017, this wasn't ours, but this was out of Gallup. Domestic altercation, a man left on a foot with his son. He was possibly intoxicated. It was here in Gallup, and it was reported once it pushed out. This is how it went out. They were able to locate the child here in Gallup, but that's an example locally. So for us at Navajo Nation, we have a website. So this is where you can go to log on to get any type of alerts that we might issue, whether it's a local emergency, wireless emergency alert, weather alert. You'll go to this website. It's www.alertindian.com. You go to that website and you can create your profile. You can pin drop your location of where your home is, and you can sign up for alerts. You'll go here, sign in, or create a profile. Any events or anything that we have, you can click this tab on this side, and it'll show any weather alerts that are pushed out, any weather alerts that are active. We monitor all the national weather when they issue weather alerts, so that'll go out to your phone, it'll go out to your email, it'll go out to your business phone, whatever numbers you want, you're able to input it to that. And then from your cell phone, so if you want, you can text Navajo Nation, one word, to 888-777. That's going to automatically opt you in for our services. And from there, you'll get a kickback saying, create your profile online. If you want, you can do that, or you can opt in anonymously. And we don't collect your information. We don't monitor your phone number, any of that. All you're doing is you're opting in for our service. And that's what you can do. So when we push out alerts, we push it out kind of redundant, whether it's an EAS, which is emergency alert, whether it's a WIA, whether we push it out to your email, whether we push it out to your cell phone. We have a redundant system to hit all of those factors there. And that's what you can do. We try to tell people, text in. So it'll show me a report of how many people have opted in this morning by the end of the day. So hopefully how many people we have in here, like over what, close to 30? Maybe we'll see a jump in 30 people if you have not already opted in for it. That's what we usually tell people to opt in. But I'll leave that on there and cut it with about 5 minutes before time's up. I'll answer any questions that you have. I know it was really short, but that's kind of where we're at now with the system. The system is live, has been live since 2017. Of course, you all know the tragedy that happened back in 2016. From there, that's how we got involved in this and how we took the lead in getting it. So that's pretty much what I have for my presentation. If you want a little bit more in depth, if you have questions, feel free to reach out to our office. We'll be here for quite a while, and then after that we'll end up cutting out. But that's it in a nutshell, if you don't have any questions.
Thank you, Mr. Cleveland, for your presentation. It was very informational. One question I have is, once you have all the criteria in place, or even before, how long does it take to determine an Amber Alert?
Based on the investigation, it could take it just depends on the investigation. It could take as soon as we get the call. So normally what happens is, as soon as an incident happens, dispatch will call us. One of the 7 districts will call us from Navajo Police, and then they'll get us up to date, saying, hey, we have this going on. Here's, heads up. And majority of the time, we just end up mobilizing and deploying out because we know it's going to drag on a little bit longer, and then time is of the essence. So we want to make sure we get out there as soon as we can to assist and coordinate and gather all that information. So it could be from the time of the call, it could be within an hour, it could be within 2 hours based on the investigation. If we don't have all that descriptive information, then we start going back and say, okay, this is what we need. And like I mentioned, one of the drawbacks is people not having current photos, not having descriptive information. Everybody's got cell phones, and yet we still find the challenge of trying to get current photos. So it kind of just depends. But as soon as we get the call from our office, then we're usually out the door within an hour.
And then my next question is, I know you mentioned that this platform is only available to Android users. Do you know when it would be available for iOS users, the individuals that have cellular one?
That's something that they're working on. I know they're renewing their agreement with FEMA, so I'm not sure how long, but that's why we encourage people to create a profile, put as many information, your contact information in there, whether it's your email, text opt-in, because we push it out through text message, and when you get it in a text message, it'll be a URL or a PDF format, and you'll be able to see it. So we've thought of that as a redundant backup.
Does anyone else have any questions regarding the Amber Alert? Okay, got one back here.
You did a good presentation. It's outstanding. We'll call it 2 questions or comments. One is natives versus non-natives. I don't know if that's a criteria question or non-native will stalk or try to abduct young native children. I don't know what your criteria said on that one, Navajo Nation. The other one is, like here in the city of Gallup, we have schools where we come from on the west side. Every now and then we see a white van parked over there by the school. We call the police department. There's no answer. So, we were concerned about this white van. Somebody else mentioned that van also, besides me and my wife. So I don't know if you can answer that for us or not. Some of us, we live here in Gallup, Ibn Najishna. We're, I guess, considered urban Navajos.
For us at our level, at the criteria-wise, regardless whether they're native child or non-native child, as long as they meet the criteria and they're within Navajo, we'll issue our own alert. Because time is of the essence, whether it's a non-native child or a native child, we want to make sure we recover that child, we get that child home. Giving you an example, a couple of weeks back or a couple of months back, we had a non-native child in Ganado who was playing up there by the sand pit and ended up wandering off. So that child was missing for, once we got the call, probably about 3 hours. So we were thinking, okay, is this an abduction? We started investigating, we started tracking, and we were able to locate the child. The child was wandering back home. So regardless whether it's a Navajo child or non-Navajo child, whether they're on Navajo, we treat them all the same. We don't segregate, we don't keep them different. As far as the white van, I really can't answer that question. That would be something referred to the police department. They would be able to answer that.
I think we have time for one more question, and then we need to get into our next presentation.
Hi there. That example you just gave about the sand pit and the kid, I'm curious, it seems like it might be hard to determine if something's an abduction or just a missing child. In that case, do you tend towards the Amber Alert or away from it? Do you have to confirm it's an abduction?
We have to confirm it's abduction. Majority of the time, we treat them as a missing child. So with this child, being that the child was 6 years old, we automatically called in the helicopter from Phoenix, from Arizona DPS. So we want to bring as many resources as we can to help locate that child. Now, if somebody comes up and says, hey, I seen this vehicle pick up this little child and left, and okay, now we need to start looking at, okay, this might be an abduction. But majority of the time, we treat them as a missing child. Whether they're adult or a child, we treat them as missing first, and we start bringing in additional resources to try to locate, and we start looking, okay, where was the last direction?
Thanks. Thank you, Mr. Cleveland, for your presentation, as well as your staff member, Lavina. So with that, we will go ahead and go into our next presentation. We appreciate you taking the time. I know you're busy. Again, another part of the MMDR initiative is we're looking at ways to collaborate with our law enforcement as well as emergency management. So we're really glad to have them in this conversation. So I'd like to invite Mr. Dave Baldridge, who will go into our next item, and it is so the counterpart to when our children go missing. We also have several instances where our elder relatives may go missing, and generally it could be because of a medical or mental health issue. So we want to also make sure that we're covering our bases. So we have Mr. Baldridge here, who has worked with a team to develop an app that would not only create that awareness, but also provide us information on how we can mobilize.
Thank you very much. Let's see. Good. And do you want me? Do I advance the slides? Yeah, would you? Yeah, I'll just say next. Thank you. Well, thanks you guys for letting me come and join you today. I'm Dave Baldridge, Executive Director for a little Indian nonprofit we call IA Squared, the International Association for Indigenous Aging. The rest of our team is back east in Maryland. I am in Albuquerque. I'm a member of Cherokee Nation and pretty much a lifetime urban Indian. I want to talk with you today for a bit about the two greatest passions in my life, Indian elders and search and rescue. I've been a national advocate for our elders for 28 years now. I ran the National Indian Council on Aging for a dozen or so of those, and I'm now Executive Director of IA Squared. We are leading the nation's efforts, we think, in dealing with dementia in Indian country. And so I wanted to bring a small slice of this to you guys today and see what you think about it. I am so happy to have worked in the past with Larry Curley, who founded NICOA, Navajo, my longtime friend, and is now the new executive director again. Frank Chihualetto, code talker from Crown Point, was one of my lifetime mentors until he passed a few years ago. And your former chief of police, Gordon Totolina, did a great job helping 80 Navajo Nation officers come to one of our sessions a few years ago in Gallup for a day about investigating sudden unexpected infant deaths on Navajo Nation. So I'm very grateful and proud of my longtime work with Navajo Nation. Okay, next. In search and rescue, I've been involved in this for more than 10 years. I served 2 terms on the New Mexico Search and Rescue Board, and in probably the proudest achievement of my life, 3 years ago I was given the state's highest honor for a search and rescue volunteer, the Dowdy Award. I've been on more than 50 search missions, many of them for elders, with my border collie Teague. So let's talk about Alzheimer's if we can. Someone in the U.S. is diagnosed with it every 67 seconds. 16 million people will have it in the next 20, 30 years. 2 out of 3 cases are women. A woman in her early 60s is twice as likely to be diagnosed with Alzheimer's as with breast cancer. So obviously it's a huge problem. And next, okay. Next slide, please. Yeah, we're afraid of it. And you can click on, as you click, these will come up. Thank you, excuse me. According to Kennedy family member Eunice Shriver, Alzheimer's is having a profound effect on Americans everywhere. 96% of Americans have heard about it. More than a third of us are worried about getting it. Next slide. Several studies have suggested that rates of Alzheimer's disease and related dementias, we call them ADRD. Alzheimer's is just one type of many kinds of dementia that affects people. It's the most common though, and it's the most widely known. The studies that went on say the rates are low in Indian country, but they probably underestimate the burden because lack of awareness among our communities, underdiagnosis, misdiagnosis, and they don't especially understand Indian cultural issues. A huge factor in this is there are now a lot of Indians. Our population is growing at 3 times the national rate. More than 5.2 million in the U.S. are now AIANs, either alone or in combination with other races. From 2000 to 2010, our population grew 27%, 3 times faster than the overall American population. And elders. By 2050, the number of Indians 65 plus will triple from to 1,600,000 by 2050. Indians 85 and older, our elders, are projected to increase to 300,000 from 42,000, more than 7 times what we've been seeing. Native baby boomers, I'm one of the first of those, are now reaching old age. Some of us will soon be reaching old age. So more and more, they're a significant part of our populations. So in Alzheimer's, our small organization helped develop the national foremost best initiative about helping Americans with Alzheimer's. It's brand new this year. We broke it out at the National Indian Health Board Conference in Albuquerque in May, presenting with CDC on it. It's the first time ever to help Indian country address our growing dementia problem. Excuse me. So as CDC was developing this, they asked us to put on 2 webinars about Alzheimer's for Indian country. We did one for Title VI directors, our tribal senior program directors, another for tribal health directors. Before it was over, we got more than 40 responses on SurveyMonkey. These were our service providers in our tribes talking about their thoughts about the roadmap. Those 40 responses really showed us a lot of interesting things. It's a growing problem, Alzheimer's and dementia. 95% felt that it's a big problem, and people in our communities are all afraid of it. At the same time, we found that there is very little knowledge about it. People tend to turn away from it because it is scary and there's not a lot of help coming from our medical providers about it. They felt that even though we are very, very concerned about it, that we're not getting the education, the knowledge, the kinds of things that are going to help our communities deal with it. And that my friends, is my current work, and I'm going to be dedicated to that for the next several years. The providers that we have, whether they be tribal docs, nurses, CHRs, social workers, or IHS, they feel that our providers are not educated about it too. I had one Indian Health Service doctor tell me when we were asking, Dave, we are so underfunded and overwhelmed, and my staff is just blown out tired all the time, and we don't have money. I don't have time to take on a new behavioral health initiative. And so we find that our medical providers are not really addressing dementia. And I will bring us, you guys, to wandering very quickly. When someone has Alzheimer's or dementia, usually it doesn't show up in a medical appointment. Our population is not getting screened for behavioral health diseases like Alzheimer's. And it's more likely to be discovered by a Title VI program, a senior program, and even more than that by the elder's family and caregivers. But it doesn't show up in a doctor's office first. And so even though it is a disease and a medical issue, it shows itself in a person's behavior in our communities. So we're not dealing with it nearly as effectively as we could. There's another part. Alzheimer's, more than cancer, more than heart disease, more than anything else, takes a toll on caregivers. Alzheimer's and dementia, other dementias, don't get better. The patient always gets worse. They are terminal. If you get Alzheimer's or most of the other dementias, it is only going to get more severe as time goes on. And as our elder might start out asking for help with a grocery list, they're going to need help in the end going to the bathroom, taking a shower, eating, doing the most basic things, and the stress on our caregivers is just enormous. Because we don't want to deal with it and because we're scared of it, a lot of times we find in Indian country we're turning away and just not acknowledging it. Our culture has a lot to do with it too. Can make a difference in whether an elder and their family go to a doctor or not. Some tribes believe that life begins and ends like a child, and that an elder is going into their second and final childhood. These beliefs could keep people from seeing a doctor even if help's available. And the fear and worry for the patient, for their caregivers, especially for their family, might make it seem like it's easier to not talk about it with a doctor or something. But the sooner that we get the medical community involved, the better chances the elder will have, the better chances their caregivers will have of making it through okay. So, we learned from the excuse me. Thank you. We learned from the Title VI directors that our families' lack of awareness and resistance to diagnosis, and they're out there resisting it, might be due to fear, denial of the loved one's condition, especially if it's a respected elder, or there might be some stigma within the community for looking for assistance. We want to say it's a family matter. We'll take care of it. And privacy, as we know, is highly valued and often hard to come by in small, remote reservation communities. So that is a factor in whether a family will seek help for it or not. They may not want, quote, not want others to come in, said one director. They may not want a respected elder to know they have dementia, or they may lack the time and money to deal with their own lives, their own health, their own kids, their own jobs, in addition to taking care of an elder. And so we've got a real dilemma here. So the confidentiality I mentioned, we may not be able to count on our doctors, whether IHS or tribal, to take the lead on it. I told you about the conversation from one IHS doctor. So I think one of the biggest challenges we as Indian people face is to develop leadership. Our tribal leadership's got to get involved somehow, and there's not a clear, easy path for doing this. You know, if the people that are recognizing dementia are a family, a Title VI program, that's not flowing into the healthcare system where care will come from. So we've got kind of a disconnect, and it's very troubling. So as I end that little part, I want to know I'm really pleased to learn a little bit about Navajo Nations, your concern and your willingness to deal with missing person incidents. I think you're ahead of all the rest of the nation's tribes in this respect, and I really congratulate you on being here today and this work that you're doing. So now let's get to the missing elder part. Dementia causes wandering. Many elders will wander 6 to 8 times before they're sent to a nursing home or for help. Nearly half, this is big, nearly half will die if not found within 24 hours. Wandering can be considered a safe and healthy exercise, getting exercise, relieving stress, etc. But critical wandering, or it's called elopement, occurs when someone leaves their home or their institution and they're not aware of their situation, the time, the place. It exposes the person to dangers such as adverse weather, falling or traffic accidents. Critical wandering and missing persons are often one and the same thing, no question. So, there's a guy, he's a doctor at West Virginia University named Robert Koster. 19 years ago, he wrote a book about lost person behavior. And he talks about many categories of missing persons, whether they be hunters, ATV, motorcycle riders, young children, medium children, fishermen, all kinds of people. And one of the categories for wandering is dementia. He analyzed 50,000 cases worldwide, and this book that he wrote has now become more or less the Bible for search and rescue operations across the United States and, in fact, the world. I've been talking to Robert Koster about the project that I'm going to mention to you in just a minute, and he is totally on board, just an amazing guy, and he likes this idea. So, if it's a wandering elder, they're going to die if they're not found in 24 hours. 50% he found of elders will be gone after 24 hours. We recently lost one of your elders from Fort Defiance, and I think that person was gone probably around 24 hours or less before finding it. Could have been longer. But search and rescue can't respond in time. As I said, I'm a longtime member of a search team. In New Mexico, all the searches are conducted by the state police, and it takes 48 hours to get a team of searchers on the ground. I've been on searches in Indian pueblos in New Mexico, and it's really tough because it takes so much interagency collaboration. It's a tough deal. So if we've got a wandering elder who's not going to make it after 24 hours, getting search and rescue teams from outside the res there are not going to work. Tribes and tribal law enforcement don't have the manpower, the resources, and our communities are so disadvantaged and poor that we don't have volunteer search teams out there. People can't afford the time and the training that it takes to that when they're struggling just to make a living and keep their family going okay. So in the last couple of years, this is the first time I've presented about it to anyone. We've developed the idea that I would love to see Navajo Nation take the first crack at. It's called the Native Elder Safety Net, and it is not search and rescue, but it is a means by which our small tribal communities could find wandering elders fast before that 24-hour deadline passes. So, It involves the senior program director, the Title VI director, and the local law enforcement folks. It doesn't take a ton of resources. It doesn't involve anything from outside the community, and we think that it could be really effective. So, the senior program director would create a file on her computer or his computer for every elder, and it would contain the basic Silver Alert information, you know, the elder's name, address, car, favorite activities, habits, favorite clothing, places they used to live, because dementia wanderers often may return to a place they felt safe at a younger age. It would include a lot of information plus a photo of every elder. They could do it at the Title VI site with a Polaroid camera. You know, it's very easy to put those in a computer file. And so we would then have key information. If an elder goes missing, we'd have it right there, and it would begin as the Title VI director very easily can drop in that elder's photo to a missing person poster. So bingo, within minutes, a missing poster could be created. So the real collaboration begins when local law enforcement goes to the senior center, or it could be a nursing home, but probably the senior center, and gets the file on that missing elder, and then the local police, local law enforcement would involve other first responders and follow all of their protocols, which are very well established and good, about launching a search. So that part of it could be handled right now by your law enforcement folks. They would notify other first responders. They would notify the CHRs, the ambulance drivers, anyone else who might be available. So they've got the tribe's law enforcement and medical provider community alerted. But here is where the senior center steps in and picks up part of the role. They would create two teams of their elders who come in for their meals every day, Team A and Team B. These are volunteers, and I want to say right now, we're not talking about search and rescue. We're talking about a very fast way to identify and alert our community that an elder is missing and may have wandered. So, from the file that the Title VI director has, we know where the elders' favorite places are, where they might like to walk, what their hobbies are, where they used to live. So one team of elders might drive or walk to those places and just watch and see. And we know that an elder who's wandering with dementia is not going to be approachable, should not be approached by just anyone. They may be paranoid, they may have very limited perception, they may be scared of anyone in authority. There are really a lot of reasons. They may be in health danger. So there are good reasons for not everybody going up to a missing elder. But if we could identify where they are and let our first responders know, we could get trained personnel to that elder very quickly. So we're just looking to walk the favorite places or drive where the elder could have been or might be. Then another team of elders, we would download the poster very quickly with the elder's photo, and they would place those in all the likely places in the community. I'm thinking in a best case, we could do this in 2 hours. And oh my gosh, could that make a difference between an elder making it or not? As I mentioned, our volunteers who are out, this woman may be walking a path that an elder liked to walk, and she's just looking, but she's not going to approach the elder. She's going to call law enforcement. So our project and the very first trial of it, I hope, will be here in Navajo country, and I hope your tribal government will find a way that they can support this. We could do a demonstration in 1 or 2 communities, and we've learned that one of the most important parts of all of this with our elders is educating our elders, the caregivers, the families about dementia and what the elder could be doing. And so we have an expert on our team. His name's J. Neil Henderson. He's a Choctaw. He's a 30-year colleague of mine who developed this amazing program that the National Indian Council on Aging now has on their website, called Healthy Caregiving for Indians. I'm sorry, I misstated that. The Savvy Caregiver for Indian Country. You can find it easily. But he comes in and would do a 3-day session, and it doesn't cost that much. And he would train a whole community in how a caregiver can help an elder be okay. So we've got education for our community as part of this, and we could invite the CHRs, invite the tribal administration. We could really reach out into the community and create a lot of awareness. I think this project has huge potential, and again, I'm very grateful for you guys letting me bring it to you guys first. As if the project were to work, say we brought Dr. Henderson in, I also would bring in a law enforcement officer named Chuck Melvin. He's a very long-time law enforcement officer in southern Aztec, outside of Aztec, up in southern Colorado, Dolores. And Chuck is one of the nation's experts in law enforcement and missing persons. He would come in and work with your law enforcement and first responders folks and talk from their perspective about how this all unfolds and how it best could be done. Chuck's an awesome guy, and he's already agreed to come over if we're able to get something launched with you guys. So, one more click. It says, thanks. Really appreciate this chance, and you guys please feel free to reach me anytime 24/7. I would truly love to see this get launched in Indian country, and your tribal government I'm sure can afford it. It's not hugely expensive, and we could run the project for 1, 2, or 3 years. We could pick 1 or 2 or 3 tribal communities to test it out. So hope this could help and keep some of our elders around a little longer. Thank you very much.
Do we have any questions? Any questions? Anyone? No? Okay, you have a question?
Hi, Dave. It's not really a question. It's just kind of a comment. I want to thank you. My name is Miski, and I was the one that got a hold of you earlier. So thank you for being here. Your presentation was wonderful and very informative. And I just want to thank you for traveling all the way from Albuquerque just to be here, just to be able to share this information with us.
Thank you so much. You guys do such a good job of respecting your elders and taking care of them. I'm really a fan of the tribe, so hope we can work together.
Do we have any other questions? Mr. Baldridge, thank you for coming. We really appreciate you reaching out to us, and I think this is going to be a wonderful project. We definitely would like to make sure that we propose this to not only our leadership, but we do have our Navajo law enforcement, our Navajo emergency management individuals who are in charge of those types of programs. So hopefully there's a way that you guys are able to collaborate. So thank you very much for coming. You definitely have our support. Okay, so Zoe has some announcements.
Okay, so on the registration table, there's a couple of handouts. Rehoboth McKinley Christian Healthcare Center. I always get it mixed up. Sorry, I always try to make up stuff. But they're actually our partner for this forum. And 2 of the things they wanted all of you to be aware of and also to participate in. For the first is going to be for tomorrow. That's their first annual Gallup Day of Giving. It's going to be from noon until 4 at the courthouse square, and they're taking gently used winter apparel for men, women, and children. So bring your non-perishable items, and they'll have music, free hot dogs, hot chocolate,
and there's contact information on the bottom. So that's on the registration table. The other thing is one exposure death is too many. So they have a sheet. They would like everyone to take one and post it wherever you can. I guess to increase the awareness for folks not dying from exposure, and also where to get help. I think. So lunch idea. I think an hour and a half for lunch. Okay, an hour and 45 minutes for lunch. So they're apparently going to have a turkey dinner down in the cafeteria, and it's $8. So if you're interested in having turkey and all the fixings, the cafeteria downstairs has a turkey dinner.
And we'll see you guys all back here at 1 o'clock. We will start with the public testimonies. So thank you for participating. And just another side note, all these presentations that we're having is not only just for public education, but these are also potential partners where we're able to collaborate with them, as well as opening that door for you if you feel like there's a fit within your program, within your agency, to also start looking at solutions within your program. This definitely is a chance for you all to network as well.